Hello, and welcome to the Postpartum Years podcast. I am your host, Dr. Mary Ellen Kramp. I am a physical therapist and a pelvic health specialist. Joining me today for a continuation in our lactation series is Catherine Halek. She is an internationally board certified lactation consultant, and she's one of those amazing, nerdy practitioners who is so good at what they do. I have quite the affinity for the nerdiest of nerdy practitioners who are so gifted in their specific realm. And Kat is definitely one of those people. I have
Thank
learned
you.
so much from her about so many different topics in lactation. It has been such a pleasure working with her for so many years. So today we're going to discuss yeast, Kat's favorite topic.
Oh, yeah. I love it when it's yeast. Not.
Yeast is normal within our bodies. We have bacteria, we have a microbiome, we have a mycobiome, which is a yeast microbiome as well, and it it's naturally there. But sometimes it overgrows significantly. So, Kat, let's talk about that.
The yeast overgrowth can be caused by like lots of different things. When as a clinician, when I'm working with a dyad and I hear certain symptoms combined with recent antibiotics exposure, I'm like, sounds like yeast. And as a lactation consultant, I am not allowed to diagnose anything, but I am supposed to identify and refer to get the diagnosis and the treatment. Um, Antibiotics simply just kill off everything. And like Mary Ellen was saying, there's a balance of um, good, healthy, normal amounts of yeast and bacteria and the overgrowth or bad bacteria that can happen, right? And so antibiotics, it kind of just like plows everything down, destroys everything, and then the yeast are like, "Woo, we can party. We're gonna overgrow. We're gonna look like the picture that we got going on here that looks like
The end of
a
times.
dystopian picture of a neglected building, having that knowledge that antibiotics often pull into the issue. So I recently had a situation at the hospital where I was seeing an outpatient where mom was describing her symptoms, and then she was like, "Oh yeah, 5 days ago I went to the ER for a UTI, and also they said that I had mastitis." Mind you, she had like inflammatory mastitis, not infectious mastitis, but they prescribed an antibiotic, which they should have for the UTI. And within 24 hours, the mom started having a different type of nipple pain that she had not had previously. And so I was able to guide her into the right resources for her to follow up with her providers and her child's provider.
Let's talk about thrush because a lot of parents have heard about thrush. So, explain what thrush is.
Thrush is a yeast overgrowth, and it's typically in the baby's mouth, like it's an oral yeast overgrowth. And so a lot of times people come to me and they're like, "Does baby have thrush?" And I look at the baby's tongue and I'll see like a white coating. And there's something that we call milk staining, which is basically just a milk residue on the tongue that often happens with babies that have tongue tie or um, higher arched palates, or just their tongue's not like moving afterwards to be able to like clean up the film that's on the tongue. And the secret in infants, like one way that I know an oral thrush situation with a baby is yeast and not just milk staining, is taking like a little like washcloth or a little piece of fabric. And if you can remove it, chances are it's not yeast or thrush. If you can't remove it, it is. Also, the quality of it, the texture of it, it looks kind of like little cottage cheese pieces, like really fine cottage cheese pieces. If it's not just on the tongue, if it's on the lips, if it's on, and if it's in the cheeks, and it's not just on the tongue, that also heavily leans towards thrush.
So now, if we look at the diagnosis of
Mhm.
a yeast infection in the baby, yep, you already described the white plaques in the mouth, um, but the diagnosis can also be made by blood and urine fungal cultures, but not so much if it's yeast in the mouth. That's when it's become more systemic at that point.
I also find that unless that baby is inpatient, hospitalized, that there is not diagnosis being made by blood or urine. It is by visual assessments.
Because it's so obvious as
Yeah,
to what's
yeah,
going. It's like, yeah, that's thrush.
yeah. Well, and sometimes diaper rash will be yeasty, or that previous picture with the baby on that cheek, there was like it wasn't just baby acne. Unfortunately, a lot of pediatricians, they're like, it's weird baby skin. I'm going to call it baby acne, whether it is or not. So I show up and they're like, yeah, it's just baby acne. The doctor says it'll go away. I'm like, and then I hear and look at all the other things. I was like, no, I think that's yeast. On the skin, yeast will often, before it gets really pissed off and nasty, will present itself as like a red speckly rash. And then, especially if it's in like the groin or diaper area, or for women underneath our breasts in that fold, then it becomes like really like hot pink, like mad pink, nasty looking. Um, so that's just something to think about. But oftentimes, I haven't heard a lot of my clients saying, "Yeah, they did a blood or urine culture." It's almost always by physical examination and like trial and error.
All right, let's talk about the impacts of thrush on breastfeeding.
I personally have had oral thrush. I've had a systemic yeast infection of my entire body where I had to be like on diflucan for like 2.5 weeks. And it was due to me having, like, I actually had a sinus infection that was yeast based that I kept on getting prescribed antibiotics for, that therefore caused it to get so bad that it became systemic. And it was awful. And I'm telling you what, like, I've had lots of dental work, I've had lots of, issues, health issues in my life. Um, ouch. Imagine if you've ever had, as women or men, like jock itch and or a yeast infection in your freaking mouth. Okay. So you don't want to eat. It's uncomfortable to eat. Certain things that, anything with like acid, anything like chips or anything that has like little sharp edges, super annoying, super irritating, and really just very uncomfortable. So oftentimes when baby does have thrush, they maybe they want to eat, but then they get mad while they're at the breast. Like they'll come to the breast, they'll start eating, they'll be like, no, this, and then they'll be like, but I'm still hungry, damn it. And it's like, it can be very confusing for mom who doesn't know what's going on. It also can cause the baby to want to hold the breast more shallowly so that there is less contact and movement rubbing up against those inflamed tissues. Um, and it also goes back and forth between the moms. So then it causes mom's nipples to be inflamed. That patient that I was talking about at the outpatient clinic at the hospital, her pain, the way she described it, she says, my nipples really hurt after I breastfeed more than after I pump, but also after when I pump. So the pain not being like while the feed is going, but like more intense in between either milk expression or direct feeding. That is a blaring red flag saying like, hello, maybe I'm yeast. And then also the fact that it started within 48 hours of antibiotics. I was like, yes, that is it. And baby at that time did not have signs of yeast. in that moment.
We know that that baby's going to be uncomfortable.
Hmm.
And I know I've heard you talk about how it can create issues with feeding in general. So,
Yes, even bottle feeding. Um,
mhm,
so babies are really smart cookies, and if something is continuing to cause them pain, they often will just be like, no. They'll just be like, no, I'm good. And they will either eat just enough to survive, but not actually to gain weight and thrive, or they will just stop eating. And I've seen babies stop eating bottles and breast with thrush, so both of them, and that can really be confusing to parents because it might seem like it happened all of a sudden, or like gradually it's gotten worse. And if they haven't gotten the diagnosis and they haven't started treatment yet, it could really just be like, well, I'm not going to keep fighting them at the breast. And then you switch to the bottle of pumped milk or formula, and then they start having issues there. And you're just like, oh, well, I got to feed the baby. How does that work? If they won't freaking eat. So it's stressful. It's very overwhelming. And oftentimes it takes a while to get adequately diagnosed because before you actually see like a really wicked oral thrush, like when it's like in the cheeks and it's curdled, and it's chunky and it's everywhere, that has been brewing for a moment. And so the baby's behaviors, depending on how sensitive the baby is to those sensations in the mouth, it could amp up before it's actually visible in the mouth. And
mhm.
unfortunately, because I am one of the rare people that the baby and the mom is my patient at the same time, I will hear from the mom, my nipples hurt. And that could be before the baby starts showing signs. But if you are a pediatrician or a doctor that's only treating the baby and the baby doesn't have any signs of it, sometimes they won't treat it, even if the mom has it. So it's just very, it's not looking at the whole picture. It's one of the ways that the siloing of our healthcare system really fails lactating dyads.
Yeah. And one thing I've heard you talk about is how when the baby is responding to that mom being in pain.
Oh,
So,
yes.
yes.
Yes. Mom and baby are one unit. And so when mom is like this, oftentimes baby is very tense too, and then comes to the breast very shallowly, or is like doesn't want to cause their mom pain and is like, oh, this is not good. Like something wrong is happening. One of my coworkers heard this phrase in a training, and I don't know the person that she's quoting, but feel free to leave in the comments if you've heard this before and you know who to attribute it to. It's not mine. But what's good for mom is good for baby. What's good for baby is good for mom. So baby and mom are they're feeding off of each other. And so when moms are stressed out and they're in pain, oftentimes they will space out feedings longer. So they won't be feeding as frequently. They won't follow baby's cues. They'll be like, okay, the bare minimum is 15 minutes on each side, and every 3 hours, that's all I'm going to do, whether or not the baby's queuing or not. And then so they're delaying feeds, their breasts become more it's just a recipe for disaster basically when you're not cue based feeding and in sync with your baby. So it just throws off that connection, that responsiveness, and then also baby feels the stress in mom. Now, mind you, I just want to say, because I personally have had mental health issues, and don't want anybody listening to this to think, oh, I'm depressed or I'm angry or I'm sad. And so I shouldn't breastfeed because baby can feel it. Actually, that connection with the baby outside of like pain, like actual physical pain, can actually make you feel better. So I don't want it to be taken as I'm saying, like, oh, like, if you're stressed out, your milk's not good. No, that's not what I'm saying. In some cultures, that's something that's told to moms, like, oh, you can't be depressed or upset or have emotions because your milk's going to get spoiled and it's going to hurt the baby. That's not what I'm talking about. I'm just talking about that when we are in pain and baby can sense that we're in pain, it causes issues.
So, let's do just a happy baby intermission. Think about that. Happy mama, happy baby. The baby's asleep. The baby's content. The baby does not have yeast. Mom does not have yeast.
Oh, this is a happy dyad.
Happy dyad. Okay. So now that we've cleansed our palate there, so to speak, Kat, let's go into what does a yeast infection in the breast look like?
So there is yeast that is on the skin and nipple, which is what we are typically thinking about when we think of a yeast infection of the breast. Um, a yeast infection in the breast is what we would call like a phlegmon, because actually I've heard a phlegmons be called a yeast infection of the breast. And a phlegmon, if you remember from our mastitis podcast, is kind of like, instead of it being like a clear clogged duct, it's almost like a mass of tissue that's just kind of pissed off. That
Sometimes
resembles
inflamed.
cellulitis, huh?
Yeah, so sometimes inflamed, sometimes infected. Yes.
Yes. And so it's simply an overgrowth of yeast. Like a yeast infection in the breast is an overgrowth of yeast.
And let's look at what the signs of that yeast infection are.
Yes. I'm going to go back to this, most recent case study of a dyad with yeast that I've been dealing with. Mom's nipple, when she took her bra down, looked way pinker than it previously had. This mom was Middle Eastern and had more, not quite, very, very dark nipples and areola, but like I had worked with her after birth and I had worked with her a week previously. And when I saw her nipples, I was like, ooh, those are pink and they're mad. It was like smack you upside the head, obvious to me, especially since I had a previous point of reference to go off of, where her nipples weren't unhappy like that. It also, her nipples, they weren't so much shiny, but there were little white flaky things that mom assumed was dry skin, but mom's nipples weren't dry. So it wasn't like an issue of mom's nipples being dry. It was an issue of the yeast, of me seeing the yeast on her nipples. When I'm working with a dyad and the latch looks pretty gosh darn good, the mom's nipples aren't showing like obvious signs of an issue. Baby doesn't have any kind of oral dysfunction that would make me think that, I'm from the outside it looks good, but from the inside something's wrong. And mom's nipple pain is out of proportion to what I would assume she'd be reacting to, with latching or after latch. So that's something that I always think of in the back of my mind of like, okay, to me, it's not making sense why this mom can't handle this latch. But what else could there be going on? Because her pain is telling me something very, like, it's telling me like, oh, I need to keep digging and figuring it out. Um, Burning nipple pain and pain radiating into the breast. Um, the nipple and the nerves, I hear and see moms having weird, different nipple pains from various reasons, sometimes yeast, and it kind of going back into the breast, like with like sharp or like needles. Um, this mom described the nipple pain as stingy. And so if it's achy or dull, I don't usually, my brain doesn't go yeast, but stingy, itchy, burning, those pain quality assessments of mom will lean me towards yeast. So like I was saying earlier, the timing of it, like usually, sometimes I hear moms saying that when they pump or the initial latch, it feels like glass shards are being raked over their nipple, which just, oh my goodness, I really
Uh,
should someday just come up with like a description like a book of all of the ways that people have described things to me, because to me it's very entertaining. Unfortunately, that they're suffering, but just like how creative the descriptions
The
are.
descriptions get,
Uh,
yes.
yeah, it's fascinating to me. So that, raking your nipple over glass shards is a description of that initial latch or pumping pain. But usually, as the latch or the pumping goes on, that shards over glass nipple pain like gets a little bit better. And then when they're not pumping, they're not breastfeeding, boom, it flares up again. And usually it's more like sharp pain, like a sharp pain. Um, in addition, itchy. Like I had one mom come to me and she was just like, I just want to claw my nipples off because they're just so itchy. And I was like, okay, that's yeast. Like, like to have that significant. And she had all the other signs in addition to.
So let's look at how it's affecting the two of them together. So, mom's in pain often.
Hmm.
If she got it
Yes.
first, she's in pain. She might be withdrawing. Baby might be picking up on that. Baby might,
Hmm.
develop some aversions because baby doesn't want to hurt mom. And so
Yep.
there's that interaction going on. She's probably passing that infection off to baby.
Hmm.
So that's going back and forth. Baby's now hurting,
Hmm.
may have difficulty starting to gain weight, eating enough, staying hydrated, all that fun stuff. So, yeah, yeast infections in a breastfeeding diet are just lovely, aren't they?
Well, I oftentimes, when I'm assessing, I'll be like, okay. And sometimes, like when I'm working with dyads, I will like orally process out loud, like what my brain's thinking, to kind of include them on the journey of what we should do next. So I'll be like, okay, I'm leaning towards this might be yeast, or it could be this, or it could be that. And I really hope it's not yeast. I almost always say that. I'm like, oh, I really hope it's not yeast. Let's try to
Yes.
figure out how it's not yeast.
Yes.
Yeah.
Yeah. So let's also recap how this started in the first place. Um, and I'm going to do a whole segment, a whole podcast on antibiotics itself, but antibiotics during birth for either of the dyad can lead to a yeast infection. And a lot of women don't know that they are getting antibiotics. Basically, every woman who's getting a C section has been given antibiotics.
Yep.
Um, Not all of them are going to develop a yeast infection, but some of them are, and some of them are unaware that they received antibiotics because you just have a bunch of bags being hung. Um, when you're having a C-section, whether it's planned or whether it's an emergency or whether it's a crash C-section, however that happens, um, antibiotics tend to happen during those times.
Oh
So
yeah.
that can lead to yeast infection for the mom, and that's going to be getting passed on to the baby. Any more you want to add on? Because I know you're seeing a lot now that you're working in mother baby and
Yeah.
labor and delivery and
And
NICU.
NICU, yeah. I'm seeing a lot more that whole situation that we were talking about when we were talking about mastitis, and the fact that breast inflammation does not always mean infection of bacteria that require antibiotics. I have seen people be admitted, you know, they show up at the ER, and sometimes lactation will be called to the ER even, to like talk to them about pumping or breastfeeding, and the doc's like, oh, there's a red quadrant, it's hard, it's a little warm, but nothing else is happening, there's no fever, there's no other issues. Oh, here's your script for antibiotics. And it's just like a routine. Back in the day, before insurance companies just really started, screwing providers, um, you would oftentimes moms would just simply call their provider and be like, hey, these are my symptoms. And they wouldn't even look or assess. They would simply just call on a script and you'd go to your pharmacy and pick it up. So the fact that, and then also they're not educated. about the fact that they should be on the lookout for yeast symptoms to figure that out.
We naturally have yeast in our bodies, um, but it's not always an infection. So
Mhm.
even though the yeast is already there, um, some women are colonized with yeast, but it's not necessarily an overgrowth of yeast. So they may have kind of like different strains that may be looked at as infectious, but it's not an infection at the time. Um, and then the yeast infection itself isn't caused by one particular type of yeast. It can be caused, you know, 20 different types of yeast could potentially cause an infection. It's just what might be overgrowing to the point where it's now an infection that can affect both mom's nipples and the baby's mouth. And I think we've covered a lot of how this
Mhm.
yeast infection is impacting breastfeeding.
Yes.
So, explain again about how, well, you explained how nipple and areola pain's common with a yeast infection,
Mhm.
but I've heard you also explain how sometimes it's better when the baby's feeding and sometimes it's worse after the baby has fed.
Yeah. I really do feel like it can be worse when the nipples are not like nothing's happening. Um, Another sensation that I hear of is so like we talked about, like it's usually I hear like the initial with the feeding, then the middle it gets a little bit better like with feeding or pumping, and then when like sometimes minutes, sometimes 20 or 30 minutes after the feed has ended, the nipple pain gets worse. I've also heard moms describe not being able to have anything on their nipple without it being intensely painful, or like trying to take a shower and the water hitting their nipples just is excruciating. And that's common. That can be seen also with nipple damage for other reasons, but I really do see a high frequency of that, especially when it's been um, neglected and not like they haven't sought a resolution from it, like because we just internalize and accept that pain is a part of breastfeeding and just allow it to continue happening, thinking that eventually it will go away. And so it's usually when like a yeast infection hasn't been addressed for a while that it's that severe where they can't have any clothing on it, they can't walk into the shower, like the water hitting it or dripping is just like ah, just untenable.
Yeah. And then these untreated or misdiagnosed infections can then become systemic, which makes
Yes,
it an even longer
yes.
infection to more difficult to get under control.
I had a diet I was working with where mom had was suffering with low milk supply, baby had a little bit of a tongue tie, and like our second appointment, I was like, "Oh, y'all have yeast." Like it was in the baby's mouth, it was on mom's nipples. Well, the the sweet mom, it actually got all over her chest, it got all over her
Oh,
face. Um, and like, because she was, hugging, kissing, loving on the baby, and like, and like rubbing all over and getting this, like, it just went everywhere. And I think that that's something that's important to understand and why I hate when it's yeast. Yeast has vectors, and sometimes
yeah,
it's very hard to get rid of.
yeah. That's coming up.
All
that,
right.
that topic's coming up as we move on. Let's now talk about places where yeast infections are uh, common to overgrow. We have discussed the mouth. We have discussed diaper rash. We've discussed, you even mentioned underneath the breasts, which
Mhm.
living in Florida is, that was definitely much more common than living up north.
Yes. Uh-huh.
um,
Swamp boob is a thing, and sometimes swamp boob turns into yeast boob.
yes, yes. The nipples and areolas, particularly in a breastfeeding dyad. Um, Most women know about how it will overgrow in the vagina. We don't even have to discuss that. but it can overgrow in the throat and the stomach as well. So, yeah,
Yes.
we want to get that under control when it's in more limited areas versus when it has become systemic.
And like surprisingly, like my personal story, apparently you can have a yeast sinus infection,
Hmm.
which then turned into systemic that affected my throat and my stomach. It was awful.
Yeah, yeah. It can be so many places under nails,
Yes.
yeah, it can be in really, really chronic areas. Now, this is your favorite part.
Okay.
Who and what needs to be treated when there's a yeast infection going on, Kat? I know this is your
So
favorite thing.
the reason why I always am like, please don't let it be yeast, is because both members of the dyad need to be treated and need to be treated simultaneously and need to be treated past symptoms. Okay. So, and then all of the vectors. So, anywhere mom's breasts have touched, so like bed sheets, bras, t shirts, breast
Pajamas.
pads that are reusable. Um, oh, here's a hot tip that I get asked this and I'm surprised, but I feel like people don't know that every single time there's moisture on a disposable breast pad, you should change it. You should be taking it off and putting on a new one that's dry. Like you shouldn't be reusable breast pads specifically, like, and also washable ones. Like you should not be like putting moisture back onto the breast. I see that can be a cause of nipple and areola yeast overgrowth, is the fact that they're reusing something that's already moist and it's in a dark place and it's just like boom. So yeah, side note there.
Yeah,
And then anything that's touched the baby where the babies have the yeast infection, including, if it's cloth diapers, the yeast can live in cloth diapers and not get killed properly. And then cause reoccurring diaper rashes of yeast infections. I've seen that happen a bunch. One popular way of resolving that doesn't damage the absorbency of a cloth diaper is sunning them, is like letting them out and having them be in full sun for like over 20, like 2 days in a row. Um, so that's just a tip about that. I also sometimes will recommend, like, if there's something that you can't wash, and take the fabric off of that you think might be contaminated with yeast, to put it outside and have the sun do a little work, that somehow that helps. So breast pillows, breastfeeding pillows, sheets for the baby, blankets for the baby, burp cloths, bibs, um, the baby's clothes, all of those things are also vectors for the yeast. Not to mention nipple shields, flanges, bottles, nipples, pacifiers, um, utensils, all can be vectors for yeast that need to get treated and worked on. And then my soapbox is the fact that the mom has to see her OB or her primary care to get medicine to be treated. The baby has to see their pediatrician. And once again, I mentioned earlier, sometimes one does not have the symptoms. Okay. The provider might be like, well, I don't need to treat, because they don't know it's going to get passed back and forth. I don't know how they, like, in this day and age, we don't know this, but sometimes they don't feel comfortable prescribing something if they don't see the proof and the evidence in the person that is their responsibility. I also wanted to mention that oftentimes pediatricians, even when mom is exclusively pumping, will assume that she is direct breastfeeding, that she is latching baby. Whether they know baby's getting breast milk, they assume breastfeeding is happening. Okay. I had a dyad that I worked with in Florida during COVID who called me, and her nipples were severely damaged. And she was not direct feeding at all. So the baby, like, baby's lips and saliva had not touched mom's breast since birth. Okay. So it was not an issue of them passing it back and forth. But her pediatrician actually did recommend mom treat her nipples with the treatment for the baby. So here's that one special pediatrician that was like, oh, here, you should use this on your nipples too. And the fact that mom didn't have yeast to kill off and kept using the antifungal on her nipples, it caused her nipples to have severe damage, and unnecessarily so. And really, if they had just dug a little deeper, assessed the dyad, understood what was really going on, mom didn't need to be treated for yeast. It was just the baby that needed the treatment. There was zero need for mom's nipples, and mom had severe nipple damage because of it.
Mm.
So that was really frustrating. And then some people, like in our healthcare system, depending on your insurance type, you may kind of not have a primary care physician, and your OB sees you at your little 6-week follow-up postpartum appointment, is like, go into the world and I'm no longer your provider, right? So sometimes it can be very difficult for families to find it. Um, Midwives, especially lay midwives, will often assess and treat the dyad up to 6 weeks. So I've known a lot of home birth or birth center midwives that will co-treat easily without any issues the dyad, because they see them both as their patients. But then magically at 6 weeks, that stops being a thing.
Yeast is going to be living on multiple surfaces, and you have to treat all of them um, so that you can get rid of the yeast. So while mom's being treated, while baby's being treated, or whoever in the dyad needs to be treated, if it's exclusively bottle feeding,
Yeah.
all the clothing, all the fabric, all the sheets, bedding, bras, yada, 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 plus bottles, pacifiers, nipple shields, pump parts, all those things need to be treated to get rid of the yeast. And it's ongoing because you're going to be using the bottles and the pacifiers throughout the treatment process. So you need to keep cleaning that clothing and those bottles
Yeah.
and those pacifiers and those nipple shields every single day.
The way that I clinically have found, and mind you, there's no research that supports this. This is my clinical experience of doing this for 14 years, is if you get the treatment started within 24 hours of the treatment being started for both, for wherever it needs to be started, within 24 hours, do the deep cleaning of the baby's clothes, of the fabric, and all of the stuff. And then treat 2 to 3 days past any symptoms. So, like if mom's nipples are happy, there's no pain, continue treating, like continue the medication for 2 to 3 days. If the baby has zero signs in the mouth, continue to treat 2 to 3 days past that. And within the last 24 hours of using the medication, once again, do that really intensive deep clean. Again, that is a big reason why I don't want it to be yeast whenever I'm seeing it. I'm like, please don't let it be yeast, because wow, there's just so much work that this family who is already not feeling so hot, already having issues, is going to have to do to knock it out. That systemic yeast infection that I referred to about me personally, that was because I had treated it. I had stopped treating it when my symptoms started getting better, and then it came back with a freaking vengeance. And that's what yeast will do. If you don't get it good the first time, it'll
Yeah,
come back with a vengeance.
yeah. The question we always get is, should I still be breastfeeding when I have a yeast infection? Should I be breastfeeding when I have mastitis? Should I be breastfeeding? And your answer is always yes. It is safe
Yes,
to
please do.
breastfeed.
And also
Yes.
get with somebody that can help you navigate it until things are better. So, sometimes it is appropriate, if the pain is so severe for mom, but it's significantly less severe with pumping, for mom to maybe not breastfeed as much if pumping and bottle feeding is being successfully used. So, but you really want to do that with guidance. You don't want to just kind of play with it. And you want, you know, specialists to be able to like say, yeah, you can do that for this period of time and then stop, right? Like we want to, if we're doing a coping strategy or in the short term, we want to be able to know when we can stop it.
Yeast infections are manageable. Both parties need to be treated and everything needs to be cleaned, but breastfeeding can still happen. Get with your IBCLC and your physician, whoever that may be, to work with them on managing yeast infection if you think you have one. I hope you enjoyed this podcast, and we'll see you next time.